Good morning, everyone. Great to see you again. And today, during session 3, we will be discussing adolescent mental health. And in the afternoon, we will return to yesterday's session 2 to continue our discussions. And first, we will have a keynote presentation by Dr. Nishida Atsushi, Director, Research Center for Social Science and Medicine, Tokyo Metropolitan Institute of Medical Science.
Good morning. Thank you very much for giving me a chance to talk here today. I am a Director of Research Center for Social Science and Medicine in Tokyo Metropolitan Institute of Medical Science. Our research institute has been founded by Tokyo Metropolitan Government, and our research section has some role and aspiration to contribute to make evidence-based public health policy. My professional field is public mental health, particularly youth mental health and suicide prevention among young people. Today, I would like to talk about two promising evidence-based prevention strategy for mental health problem among young people, which Tokyo Metropolitan Government is now developing and implementing through the collaboration with us. So when we hear the word adolescence, we often associate it with energetic life stage, vitality, and good physical health. However, a huge amount of scientific evidence shows that adolescence is actually the period of life when people are most vulnerable to mental health problems. Mental health problems are now the single largest health burden during adolescence globally. They have a profound impact on young people's daily lives, including their learning, relationships, and other social functionings. Since the COVID-19 pandemic, many countries have reported a substantial deterioration in youth mental health. It is estimated that around 10 to 20% of adolescents experience depression or other mental disorders. Japan is no exception. In recent years, suicide among young people, especially among young girls, has increased dramatically. In our own longitudinal population-based cohort study in Tokyo, which has followed around 3,000 children over many years, we found that about 10% of adolescents were experiencing severe depressive symptoms at the age of 16. The 10% may sound like a small number, but at the population level, this represents a very large group of young people. It is clearly indicate that mental health is one of the most serious public health issues facing this generation. Yes, adolescent mental health problems do not affect. Adolescent mental health problems not only affect daily life in the short term, but can also shape physical and mental health across the entire life course. There is a growing evidence that mental health during adolescence is linked to future chronic illness, social outcomes, and even life expectancy and mortality. Furthermore, adolescents who experience depression are more likely to experience depression again during pregnancy and after childbirth. We called it prenatal depression and postnatal depression. So this means that adolescent mental health may also affect the next generation through impact on parenting and child development. So if we could effectively prevent mental health problems during adolescence, the potential benefits would be huge. the improved well-being in youth, the better long-term health through life goals, and healthier development for the next generation. We sometimes describe it as a triple benefit. However, in many countries, including Japan, most children and adolescents still don't have access to effective preventive strategies. And globally, mental health systems have focused on responding after problems have already become severe. In other words, we intervene downstream after young people are already in distress. However, this approach alone is no longer sufficient. The scale of the problem is simply too large. We now need to move upstream and build effective evidence-based prevention system approaches that can reach young people before serious problems developed. So, how can we deliver effective prevention to large population of adolescents? Today, I would like to introduce promising two approaches that are gaining a strong global attention. The first one is improving the school climate. School climate means a school atmosphere. The strong evidence has shown that the schools are one of the most powerful environments for promoting mental health. When the overall atmosphere of a school is positive, when students feel safe, respected, and connected, rate of depression, bullying, and school violence all decline. So importantly, intervention studies show that targeting school climate is more effective than addressing each problem separately. By improving the overall environment, we can simultaneously improve multiple important outcomes. And international organizations such as WHO and UNICEF have long promoted the idea of health-promoting school, which emphasizes the importance of a whole-school approach to enhance school climate. And in recent years, Professor Bikram Patel's teams at Harvard Medical School has developed a concrete and practical method for improving school climate with strong evidence of effectiveness, which published in Lancet. One key innovation was the introduction of external youth coordinator, who were not school teachers, whose role is to focus specifically on student well-being and school atmosphere. This has proven to be a critical successful factor. And school climate is not a bigger concept. It can be measured scientifically. We have developed a Japanese version of internationally validated school climate scale, which are now being used across schools in Tokyo. The school climate consists of four core components. The first is a trust and supportive relationship between teachers and students. And second is a respectful and safe relationship among students. And third is students' active participation in improving their own school environment, which we call agency. The fourth is a learning environment that supports future-oriented goals and motivation. The schools that score highly on these four dimensions are described as having a positive and comfortable climate. As you know, agency is also recognized by OECD as one of the most important educational outcome for 2030. So in schools where school climate improvement projects are successful, something interesting happens. Student voice become more stronger. For example, speak out boxes being to receive many more ideas and opinion. this happens especially when external youth coordinator are involved. In contrast, when only teachers manage these projects, student participation tended to remain low, and the school atmosphere improves more slowly. Yes. So, building on successful program in India and Australia, we are now developing a Tokyo model together with Tokyo Metropolitan Government and Harvard Medical School. This initiative is called the Igokochi Project. Igokochi means school climate in Japanese. Igokochi Project. And it is currently being implemented in 16 schools across Tokyo. Similar projects are now underway in Brazil, UK, Australia, and India. We collaborated closely which international research teams and share data and experience to strengthen each country's model. So if your city and the government are interested in such an international network, please join, contact us. Yes. So in the Igokochi project, we send a trained youth coordinator in each school. These coordinators collect student opinion and work together with students and teachers to design practical improvement. Through this process, trust among students increased, trust between students and teachers improves, and students' sense of agency become stronger. The students generate many creative ideas. For example, improving school space, organizing events, improving communication with teachers, or making daily routine more comfortable. So by gradually implementing this idea with the whole school community, the overall climate improves step by step. Our preliminary data already show a strong association between school climate and student mental well-being in Tokyo. The Tokyo government plans to scale up this program after rigorous scientific evaluation by cluster randomized control trial. The second promising evidence-based prevention strategy is the use of digital tools which promote psychological resilience among young people. If we can deliver evidence-based training to enhance psychological resilience to a large number of young people, we can prevent mental health problems effectively. The digital and AI-based tools offer great potential in this area. Recently, a highly effective mental resilience apps was developed by a research team by Kyoto University in Japan. The evidence was published last year in Nature Medicine. It's a top scientific journal, and attracted global attention due to the large preventive effect on depression. The Tokyo Metropolitan Government is now exploring how such a digital training system for psychological resilience could be adapted for young people, adolescents. So this digital training approach is based on cognitive behavioral therapy, one of the most well-established psychological treatment. This slide introduces the basic cognitive behavioral model. It explains that when we face a situation, we respond through four connected components: our thought, our feelings, our behaviors, and our physical reaction. These four aspects constantly influence each other. So changing one of them can affect the others. For example, imagine you say goodbye to a friend after school, but they walk away without responding. You might think, I was ignored and feel sad. If you go straight home, you remain sad and anxious. But if you change your behavior and call out again, the friend may turn around and wave back, and your feeling also change. This example shows that by changing our action, we can change how we feel. So this slide introduces a large resilience training conducted by Kyoto University. The study tested 5 key cognitive behavioral skills in digital environment. These skills include broadening one's perspective, including enjoyable activity in daily life. We call it behavior activation, and problem solving, and communication, and improving sleep. Using a smartphone application, the study involved over 5,000 adults aged 18 and above. It is one of the largest resilience trials ever conducted in Japan and among the largest in the world. So this slide summarizes the main result of resilience trial. The participants use the app for only about 3 hours in total, around 5 minutes a day for 6 weeks. Despite this short intervention, the effect size ranged from 0.2 to 0.7, which is comparable to or even greater than the typical effect size of antidepressant medication. Importantly, the effects were sustained for 6 to 12 months, even after people stopped using this app. Among individuals at high risk of depression, about 10% would normally develop symptoms within 1 year. However, when people learned resilience skill by this app, this risk was reduced to around 5%, effectively halving the risk. Sorry. So this final slide summarizes 2 key evidence-based strategies for promoting adolescent mental health in Tokyo. The first strategy is improving the school climate. This is a collaborative project between Tokyo Metropolitan Government and our research institute and Harvard Medical School, aiming to create safer and more supportive school environment to reduce mental health problems. The second strategy is using evidence-based digital tools. In collaboration with the Tokyo Metropolitan Government and Kyoto University and our institute, we'll begin developing a digital resilience training program specifically for young people. These programs are based on digital interventions that have already shown a strong effect in large randomized control trial with adults. So together, these approaches allow us to move from treatment to prevention and to deliver effective mental health support both at the school level and at the individual level. Yes. So thank you for your attention.
Thank you very much, Dr. Nishida. And now we will have presentations from 4 cities. Each city is requested to keep their presentation within 10 minutes. Our staff will call up on the next presenting city, so please wait at the left side of the screen. Okay, now we will begin with Cardiff. Please begin your presentation.
Bore da pawb, a diolch am gwahoddiad i'r gynladd hon. So thank you very much for the warm invitation to be here in Tokyo and to share perspectives from Cardiff. I'm a little different to everyone else here in the sense that I'm actually an elected politician, so I'm not doing this on a day-to-day basis in terms of the groundwork with our young people. So hopefully I will do my staff very, very proud by talking through the amazing work that they've been doing. So just to give a bit of context, I am the Cabinet Member for Children's Services in Cardiff. So that gives me responsibility for over 3,000 children a year who are care experienced, at risk of harm, or in need of general support. And just for a comparison to other cities here today, Cardiff is probably the smallest city that is represented around the table, with only approximately 360,000 people in our population. But it is the fastest growing core city in the UK, something we're very, very proud of. And then in terms of our regional work around mental health, as a local authority, we don't hold responsibility for health services, so we do work in partnership with our neighbouring local authority and our health boards. So what I'm going to talk about today is quite technical, so please feel free to speak to me afterwards about any of the slides that I go through, and I will do my best to do my staff justice. So what we did as part of our regional partnership across the area, we have 3 different phases of work: starting well, aging well, and living well. So starting well falls into our early years, and what we decided was that we needed a clear governance structure to make sure that we were effectively supporting our young people, and to actually bring together leaders within our children and mental health services to say where there were real challenges. So we brought together people from local authorities, health professionals, Public Health Wales, and of course our not-for-profits to actually be honest with one another about the challenges that we were facing. And I think that is something that we should be really proud of, is the fact that our staff felt comfortable to be honest with one another and to talk about the challenges, because quite often we see there are challenges around resource and funding, and therefore issues get batted around different authorities to work out who is responsible. But what we did was come together to respond to the growing demands that we were seeing. So we wanted to focus on the implementation of a no wrong door approach, early interventions to support our young people, and just to make sure that if they were presenting with any challenges, they weren't battered away and told it was another service to deal with them. We made sure that actually we were focusing on them and getting the right response to them in the first place. We wanted to focus on our more severe emotional distress and bring in a specific psychology-led service, just to look at the complexities of some of the challenges we were facing. And then we've implemented what's called our Nest Neath framework, which is essentially planning and reflecting for all professionals to make sure there is a whole system approach. So the previous speaker referred to a whole school approach within schools. That is something that we are very focused on across Cardiff and the Vale, but actually it's making sure that we recognise that it's everybody's business to support our young people through their mental health. What we did notice were there additional pressures, so the increase in need of complexities, and then we had a lot of children coming into care with complexities, which meant that we weren't able to put them in our usual care home settings, our children's homes, and we had to be very focused on providing round-the-clock support for them. And we've also seen quite a growth in our neurodevelopment assessments. So quite pressing issue for us across the UK, really, and I'm sure worldwide, that we see neurodivergence presenting more amongst our young people, and particularly at earlier ages. So I won't go into all the detail about how this was delivered, but the group did come together and we made sure that they had their objectives and principles in place. So through the Babies, Children, Young People Board, that there was that whole team approach to making sure that we weren't looking at any kind of organisational boundaries, and we were really working together. And that is a challenge between 2 local authorities, never mind bringing in the health board as well as our not-for-profits. So real challenges for us, but we wanted to make sure we had a seamless system focusing on positive outcomes for our young people, and that there was a universal and a targeted element for everything that we were doing, and making sure that we were needs-led and not focusing on meeting criteria or becoming too diagnostic in our approach. So what we've done so far, over the last 2 years, we've put quite a lot of effort into the governance and therefore the delivery of our Starting Well partnership. So we've brought primary mental health workers into our early help services, just to get that early help, that early support in right time, right place from the right person. We have a specialist mental health social worker who works in one of my teams, Sarah, who's pulled together this presentation and is absolutely fantastic. She manages to bridge that gap with health and make sure that we are talking about a young person's needs. We've seen a decreased wait for perinatal mental health assessments as well to bring them within timeframes. And we did a trial of community connectors to make sure that we were looking at the more universal social prescribing elements of what we could do rather than looking straight to targeted specific support. Sadly, that pilot has come to an end, but we're looking to see how we can continue to develop our services. So we've looked at digital aspects as well, developed a website. We've made sure that we are sharing information with parents, particularly those of children with additional learning needs. And then I will talk briefly now about our service, Galady, which means lighthouse in Welsh, just after I go through this slide, because I'm jumping ahead. So what we wanted to make sure we were doing is that we had the targeted support, which you'll see in the green, very much on our young people who have the most complex of needs, and make sure that they were going through that single point of access to carry out an assessment within a 28-day period, and assess them for the correct levels of support, and then making sure that on the right-hand side in the yellow, we had step-down services or step-up for those that were most appropriate. So if I now move on, what we had to make sure we were doing was that there was a clear discharge pathway, so a clear pathway in, but also making sure that there was a clear pathway for discharge as well, and again making sure that there was a multi-agency approach, so that the responsibilities didn't fall on any of the single agencies, and making sure that we were doing that together. But what this has essentially created is making sure that our young people aren't in hospital when they're facing distress. It's not the nicest place to be at the best of times, but actually for a young person with a mental health experience that is not so positive, you wouldn't want to be in a hospital setting. So making sure that we've got a pathway to move them out of that. It's still a challenge for us. It just means children's services have to pick up that responsibility and find a safe, nurturing space for them. And that is a real challenge for us across the UK, particularly in Wales. We've made a commitment, and it is now legislation that for-profit organisations cannot provide childcare in terms of residential homes for children. It has to be a not-for-profit or a local authority public service, just to make sure that young people aren't treated as commodities and being discussed in a way that they feel that they are essentially going to the lowest or highest bidder depending on the support that they need. So that's added some complexities, but certainly is the right thing for us to do. So Galady, which means lighthouse in Welsh, is our system where we focus on the more complex emotional distress that young people are going through. And the plan was to reduce the time spent on paediatric wards for children and young people, again, bringing that multi-agency discharge planning into place, and actually focusing on that multi-agency approach as much as we can. So we created a staffing team that is clinically led, but also make sure that we have support from local authority in terms of specialist teachers and social workers, and also the contracted services around our homes for children. So you'll see on the top right for yourselves is looking at our different kinds of places that we would expect a young person to step down into, whether that's independent living for our older young people, or if they can stay with some kind of family member or return home at the ideal. So we focused on a trauma informed lens, and instead of asking what's wrong with you, we ask what's happened, and we make sure that we're exploring that with young people to get as positive as we can with their mental health. So Sarah, who I mentioned, is our specialist worker. She is absolutely brilliant. You'll see from the slides, which I won't talk through because they'll be in your packs, but you'll see the achievements she's had, particularly the building of relationships and building that confidence for other practitioners to make sure that this is widespread and it isn't solely down to the work that she is doing. Some of the themes that we've seen through our project is neurodiversity, as I mentioned, but actually looking at how we support parents to support our young people through that, particularly behaviours that are challenging, self-harm, suicidal ideation, but actually the emotional distress that we see from our young people who have experienced child sexual abuse. So just making sure that staff are as confident as they can to support our young people. And then just a little bit of data to finish off, because I am a big fan of data, because we can be data informed and make sure that it is sending us in the right direction, but we need to make sure that we are using this in the best possible way. So what the data is actually telling us is that we're seeing a lot of younger people presenting for support and actually looking to our services to get that help at the right time from the right person, but also seeing emotional dysregulation on a higher level, and some of our services struggling to cope with them. So happy to take any questions in the Q&A after, or to have a discussion with colleagues during the break. Diolch yn fawr iawn.
Thank you very much for your presentation. And the next is Houston. Now, please begin your presentation.
Thank you very much. Good morning, everyone. And thank you again, Tokyo Metropolitan Government, for convening us at the Global Forum for Children. Houston's presentation will specifically focus on the Youth Mental Health Manual that was developed at the City of Houston, but it was developed by youth for youth. That's the key takeaway for the entire presentation. I'd like you to remember, by youth, for youth. But before I tell you about this project, I would really love to give you a little bit of a context about the office and how it works. So the office essentially covers cradle to career. That's about 0 to 24. That's approximately 37% of the population of Houston. We incorporate young people's voices into policies and programs to ensure safe and equitable Houston. The way I run the office is a reflection of my identity. I'd like to share 3 things about me. 1, I'm an economist by training, so everything is data. So all of my programs begin with data analysis. We ensure that we understand the data first, and then we go into the community and ask young people to give us color about the issues we've identified. Data can tell you one thing, but young people can tell you the true meaning of what that data tells you. Next, we identify resources and funding. And after that, no, it is not developing of programs. We actually seek partnerships with community organizations to develop this program. And that's the key difference in how I like to run my office. We are not experts in mental health issues. We are not experts in youth. But the community organizations who work on the ground, they know where youth are. They are able to help us. And so we tap into that potential to actually promulgate our programs. And then finally, of course, if there is no programs, if there's no community organizations, we create those and we do a program evaluation for every single thing. Second thing I'd like for you to know is that Houston is the United States' most diverse city. 25% of the population is international or foreign born. As an immigrant, I put cultural context in each one of my programs, and that's my identity. I want to make sure that every single person feels welcome, regardless where they come from and regardless what the programming is about. And the last thing about me, I'm a public servant at heart. I love to help people. And I don't mean this lightly. I really love to help people. Most of our programs have something called a blueprint. Everything that we've developed, the process of how the program came to be, the successes, is available in a document, in a process that other cities can jumpstart if they find these programs successful and they think that they can implement in their own communities. So do reach out to me if you find any of these programs that is interesting to you. The programs that are not successful are not listed. But we do have, for example, workforce development. It's a very robust program, and I'm happy to share the blueprint of how we reach out, how we manage employers, how we do youth outreach, the messages, all of the above, including the mental health manual that I delivered today. It's available as a resource. You can take it, edit it, remove the City of Houston logo, change the title. Feel free to use it in our community because it's an evergreen content. Young people struggle with mental health issues. They are the same across the world. Okay, so diving strictly into the topic of the presentation. What is the mental health manual? It is a digital and a physical book, which I have lagged all the way from Houston. It was not an easy thing. And I delivered several copies in the room. Feel free to take it with you. It's also available in a digital format, so you can scan the QR code and download it for yourself. It's essentially a digital resource for ages 13 to 18 and their families to learn about mental health. It's the first step, to learn about how to take care of themselves and to have an informed decision-making about self-care. That's really what the mental health is about. It's the first step, is the intro step into mental health. So who uses this guide and what are the benefits of it? First and foremost, schools. Counselors use this guide to connect with students, to initiate, to break the ice, to get that first talk. How do we talk about mental health? A lot of students, believe it or not, a lot of young people don't know how to talk about their mental health. They know something is going on, but they really don't know how to use, they don't have the words, the language to use it, right? Adults working with children. A lot of adults who are, for example, our community partners, regardless whether they're doing a financial literacy program or early childhood education program, we always incorporate mental health and self-care into it. So they have access to this guide. If they don't know what to say and what to do, the guide will tell you step by step of exactly how to engage into the young people's lives. Counselors and mental health workers, they use this book to initiate relationship with their clients. But the last two categories is the most impactful to me, is vulnerable youth, people who don't actually have access to resources to seek professional health, mental health support. These are vulnerable youth that get access to these particular books to give them that sense of somebody actually cares how I feel, right? And the last one, I say everyone because one of the things that I discovered through our data, through the downloads, is parents are actually the most people that download the guide. So I wanted to know why. I held focus groups, and the theme was not surprising. Parents want to know how to talk to their children. They just don't have the words. Remember what I told you earlier? It's by youth for youth? Well, the language is simplified. It's not technical, it's not jargon, it's not mental health nonsense. It's about just how you feel and how to express that. And parents really want that particular language. So that's why we are so proud of this. So this is a little bit of a history again, how it began. It became with the Houston's bid to become the first child-friendly city designated by UNICEF in the United States. I already spilled the beans yesterday. We did become the first child-friendly city. We completed the process, a very grueling 4-year process to actually complete a community assessment, to complete an action plan. So in a nutshell, when we talked to the youth, we identified mental health as the number one issue, and close contenders second and third was emergency preparedness. Some of you know Houston and location of Houston. And then civic participation. To respond to that, we actually had, we developed a City of Houston Youth Ambassador Program, which is a very successful group of 60 young, passionate people who guide our programming within the City of Houston. And for emergency preparedness, we developed a set of resources that are available in the community. So this is the boring part, but it's important. The process. The process is with an initial planning, it's a discussion with young people. What do you want to include in this mental health manual? What questions do you have? The design and development was also equally important because, remember what I said, by youth, for youth. So we did not want any adult changing the tone of this, right? You will read through this manual and you find places and you're like, that's not how I would say this. No, because you're an adult. That is for youth, right? The implementation and the testing process, what you're looking at is a second edition of the manual. The first edition, we changed a few things, and based on our feedback, we included interactive activities on the end and a few other changes. And right now, we're focused on the long-term sustainability. So what that means is to promote this manual, support other cities who want to adopt this manual, help them, talk about mental health resources and things like that. So partnerships are an extensive list of people who support this. It's not just the young people, they need the support. Of course, we had the coordinators, the youth consultants, the field experts, the outreach, the funding, all of that. But I skipped artwork intentionally because I do want to point out that the artwork inside the manual was developed by young people who spent time in a showcase to express how they feel. So every picture you see in this manual is by youth, right? Community outreach is a very important aspect for us. We are right now focused on social media campaigns. Of course, that's where youth are. We translated the guide in Spanish and Vietnamese. Those are the second and the third most spoken languages in the city of Houston. We are going to, and they're not automatically translated. These are actual translators. So it's a guide that Vietnamese, for example, students can read. We had a grant to print it. Thanks to that, we have physical copies. Every library in Houston has a copy of it. We talked a lot about libraries. It's a youth space, so youth can get it from those places. And of course, we have outreach fairs. In conclusion, this is not a story, or not only a story, of a successful mental health program and a guide. This is a story of young people's input, ideas, voices as a solution to their problems. Lived experiences is the best expertise we can get to solve this challenging problem. By youth, for youth. Thank you.
Thank you very much. And the next is Mamo. Please begin your presentation.
Hello, my name is Annika Nilsson. I work as a regional developer in healthcare in the region of Skåne in Sweden and representing the city of Malmö. Very happy to be here today to tell you shortly about our work. Because of the big demands on the mental health, we have to work in new ways. So we say we have a new service logic, and we have created a digital infrastructure for the demands of increasing mental health. So Skåne is in the south of Sweden, in the north of Europe, close to our neighbors Denmark. But we have the whole region of Skåne, so we had to look at ways to make it very easy for our citizens to have guidance. Where should they go, when to go where? Because we have collected all of our organization in one organization, so there will be no gaps. So we have both primary care, specialist care, inpatient and emergency unit in one organization. And we also have special units for substance addiction that we call the Marias. So for this, to make it easy for our citizens, we have developed one digital contact center. Here we can provide both web health literacy. We have chatbots who can answer your questions really quick. And we have live chats with our nurses. And you can go on the phone to have the triage and the time booking to the right unit. And they take care of all the referrals. We call it one way in. A little bit more about CAP Skåne. We are a university unit. We had approximately 31,800 patients last year. So it's quite a lot of patients considering how many we live in Skåne. We work and we are involved in several national projects because this is a national thing that we have to work together with. We are doing a lot of digital innovation in CAP to meet the demands and do it nationally. And we also have a close collaboration with the Department of Child and Adolescent Psychiatry at Lund University, and we have great researchers with major grants, so we move ahead all the time. We also work a lot with NGOs and patient organizations, because like some of you already said, we have the same challenges. We have to sit around the same table to create the solutions. And we also have a long tradition of co-creation and user involvement of the target group, the young. And I'm so happy to hear that for these days that we're looking the same. And I also like data, so we want to have a data-driven organization because we just don't want to know that we provide a lot of healthcare. We have to know that it's also have the effects that we want. So we can see, since we have also made these new changes, we can see that we have a high effectiveness and a high satisfaction of the care. So that makes me sleep well at night. Then what is the new service logic? It's a step-by-step care model, so not everyone should have exactly the same thing, because I'm different, and you're different. So we have to adapt for that. And we also have to make a big transition, like we hear it here, to health promotion. And it has to also be person-centered, but also based on standardized care process, so our staff knows what to do when, and that is based on the recent research. And we also have made a commitment to our citizens that all residents should be able to have these preventive interventions, so that we can provide them with digital self-help contact, and we could have also, when you're a patient, to have quick treatment, but also the best treatment. We also have a lot of digital self-help and digital treatments like ICBT. So contact with us is not necessarily the same as coming to a CAP unit to see me in person, but I could be out there with my knowledge and my colleagues' knowledge. And there is a big development in, we have to do it based on the knowledge at CAP, but also in the expert of the young children. So before I was a lot working for children, I still am, but now I'm working with children. So the cornerstone have to be to the Convention on the Rights of the Child and how to do that in practice, not to read it in a book. So we went out to ask the young people of Skåne, what do you need? How do you need it? And they say, we are living on the phone, we are Googling, we are going on TikTok. You have to be there. So we created a web service together with the youth. We call it BUP Skåne Online. It's like CAP Online. So it's open always for everyone. It's for children, it's for adolescents, and to supportive adults. So it's used in schools, it's used for the teachers, but also for the parents, how to support the kids. So I recognize Houston's arguments here. And the basic is also to normalize feelings and give advice how to cope with them, because feelings are a part of life. It doesn't mean that you have mental illness. We also want to reduce stigma, and then you don't have to come visit a CAP, probably. But also have digital partnership with other regional partners, private actors, non-profit actors, and the municipalities. We get together on this platform. But to provide also healthcare when you are a patient, we want to know exactly that I am Annika Nilsson. We have a digital platform national that we can log into. And here, the citizens, they can renew their prescription, they can read the medical records, and we can provide digital treatments, like when we really know what to give just you. And treatment for all of our patients start often with digital psychoeducation. It's standardized, so the staff have it. They don't have to create each one new, but it's also person-centered. We put together exactly for your age, your kind of diagnosis, your kind of problem, and it's very various. There are short films, long films, there are short text, long text, and so on. So this is the goal, to be able to offer children and families quick help. And also we know that this could be a great baseline for a lot of our patients when we continue treatment, but for some it's enough. And we have a lot of more other digital treatment and Capscona. We have like ECBT, several programs that we have a lot of research on. So we know they work for anxiety, tics, insomnia, and so on. But here you have a professional that guides you all the way. But we also have digital groups for parents and for children and for adolescents, and sometimes they come together. So we have for behavior problems, we have for problematic screen use, and so on. So the summary of Capscona, we can say that today, with the increasing needs, we are more available than ever. We have made scalable solutions because we can't hire so much staff that we need. So we have to make this in another way, and that's the digital way. And we can see the experience is that digital help and treatment, it's available, but our patients feel like it's like a drop-in. You can choose where and when you want to do this. You can do it at home, you can do it at school, the parents can do it, they can go and have a coffee break and do the digital treatment. But it's also scalable for us as an organization. And we can also see that it's our patients that receive digital, they're satisfied with the care and with good results. And it's also equal care throughout Skåne because now we can provide the same, even if you live in a city close to a CAP unit or you live on the countryside and have trouble going to a CAP unit. So that's also very important for us. And of course, the target group has been involved in everything we have done here, like on Boop Online, every little line, the colors, the illustration, they have been picking. Because we don't only have to have good healthcare, they need to want it. Because if I should do it, it would be very boring and they wouldn't like it. So that's also, I have to learn new. So the right help at the right time, at the right place. And I think that we can do a lot of work together because I hear we have the same ideas and the same struggles. So it's very nice that we can sit here together to challenge this. So thank you from Boop Cap Skåne.
Thank you very much. And the next is New Taipei. Now please begin your presentation.
Good morning, everyone. My name is Ryan Zhang. I'm a subdivision chief at New Taipei City Health Department. It's a great honor to represent New Taipei City and share how we help our teenagers stay away from drugs. Drug prevention knows no borders. It's a tough challenge for all of us. Today, I would like to introduce New Taipei City's unique environment and the innovative strategy we use to protect our teenagers. Today's presentation has 4 parts. First, I will give you an overview of New Taipei City. Second, we will look at why adolescents are vulnerable to drugs. Third, our core focus, our innovative strategy for prevention, intervention, and care. And finally, our vision for the future. New Taipei is the largest city in Taiwan, with over 4 million people. We surround the capital, Taipei City, forming a major metropolitan hub of northern Taiwan. Because we have both quite a busy urban area and quiet rural villages, our strategy must be tailored to local needs. According to November 2025 population statistics, adolescents under the age of 18 make up about 13% of our population. We prioritize this group because when one child is affected by drug, It often shatters the entire family. To better integrate resources, we have a cross-departmental structure. Key agencies including education, police, social welfare, health, and labor affairs all dedicate personnel to this cause. Here is our leadership team, headed by Mayor Hou You-yi, together with Health Commissioner Chen Run-chiu, Deputy Commissioner Ma Jingye, Dr. Ma, and myself. To address this issue, we must understand the root causes. Why teens are more vulnerable to drugs. This is linked to brain development, identity crisis, and peer pressure. On the other hand, protective factors include resilience, warm parenting, and school belonging. Our goal is simple: minimize the risk and maximize the protection. Let's look at our action plan. For primary prevention, we use volunteer-led storytelling circles. We know that traditional lecturing doesn't really work with kids. Instead, we use the novel genre for experiential learning. Trained volunteers go into classroom for 18 weeks to create a safe space for sixth grade students to talk about real-life challenges. This program has yielded surprising results. Beyond serving 500 students annually, we have seen increased discussion during recess. I'd like to share a quick story. Please look at this picture. One day, a student found that the book was missing. It turned out that another student took it home without asking. So we thought, why not just give a book to every student? Now every year, we give a copy to each student as a gift. This shows us how much the kids really connected with the message. For at-risk teenagers, we use what we call the youth drama program. Instead of preaching or telling them what is right or wrong, we use role-playing. We ask them, if you were the main character, what would you choose? This program started as a summer camp in 2017, and over time, it has evolved into a regular program that is now integrated with the call referral system. We have two goals here. First, building resilience. We want kids to feel understood. One teen told us, listening to others' story helping me to feel true empathy. Second, rebuilding trust. For these teens, trust is more valuable than money or material support. Once they feel understood, they are much more willing to reconnect with society. For teenagers with addiction disorders, we provide an in-depth addiction care plan, much like Edison's light bulb. Our goal is to light up their future. We made a conscious shift in our naming strategy to destigmatize addiction. Our philosophy is support over punishment. We offer medical help and counseling, also remove financial barrier by waiving registration fee and co-payment. This ensures that young people can ask for help without fear of hesitation. Let's look at the result. More and more young people are using our services, and in just 1 year, the uptake rate jumped from 19% to 55%. This proves that they really have confidence in our system. In conclusion, New Taipei City's strategy is rooted in one key principle: understanding. We are weaving a comprehensive network from prevention to care. Our mission is to protect our teenagers from drug abuse through continuous innovation. We hope our experience can be helpful for your own initiative. Thank you for your time and attention. ご清聴ありがとうございました。
Thank you very much. ち着いたらかな。Thank you very much for coming back. We will return to session 3, adolescent mental health. We will have presentations from 4 cities from now. Each city is requested to keep their presentation within 10 minutes. We will begin with Singapore. Okay, please begin your presentation.
皆さん、おはようございます。
Good morning, everyone.
I'm Mingwei from Singapore's Ministry of Social and Family Development. I'm here together with my colleague Eric from a community organization called Shine that focuses on supporting youth. Together, we are here to talk about Singapore's approach to supporting adolescent mental health. So, just as a quick introduction, Singapore is a city-state, so we operate at pretty much the national level. We take children's rights seriously, and we signed the UN Convention on the Rights of the Child, and the Ministry of Social and Family Development leads Singapore efforts. A quick advertisement on these little storybooks we distributed this morning. It is part of Singapore's efforts under Article 42 of the UNCRC, the awareness article, where we want to encourage parents to read it together with their children so that they can develop strong familial bonds. And we think this in turn helps to contribute to strong adolescent mental health. In Singapore, we partner with community organizations like Shine, Children and Youth Services, and they are the ones on the ground every day, working directly with young people aged 5 to 25. And together, government works with the community to support adolescent mental health holistically. Now, let me talk about an integrated mental health network that we've built in Singapore. First off, a sobering fact is that a study found 1 in 8 children in Singapore currently suffers from a mental health disorder. And, you know, to us, that's more than a statistic. That's someone's child, someone's friend. So what do? We built a network that reaches everywhere. Not just hospitals, not just schools, but we really don't want to wait until things escalate to a hospital. So we want to raise awareness and encourage help seeking early so that youth can get the help they need early. And what we have done is we've introduced over 100 community mental health teams across our island. They are meant to be a first stop, entryway to help. And the main thing we focus on is that it is all free. Nobody pays any out of pocket for this mental health support in the community. These mental health teams then coordinate with mental health intervention teams if necessary for psychotherapy or treatment. And our services are also integrated with our primary care providers, our polyclinics, hospitals, and we also make referrals for psychiatric intervention where necessary. The 3 key pillars of our community-based services are CREST teams. This is the Community Resource Engagement and Support Team. And as the name suggests, they're out there raising awareness, making referrals, supporting caregivers, because we firmly believe that prevention is better than cure. And when you need more help, we have community intervention teams that actually provide counseling, therapy, and case management. And finally, we also recognize that crises don't only happen during office hours. That is why we have a 24/7 helpline for telephone counseling and emotional support, crisis intervention for people experiencing mental health emergencies, as well as referrals to appropriate mental health services. You can call them or you can chat over WhatsApp with them as well. We also believe in having digital mental health literacy. We want to get families involved. We need to work on demedicalizing and normalizing conversations surrounding mental health. We want to increase mental health literacy and improve societal attitudes towards individuals with mental health needs. And to support this, we give parents 3 tools. The first is a Parenting for Wellness package. This is a digital toolkit that puts power in parents' hands through practical, personalized support at their fingertips to improve their own mental health literacy. You can scan the QR code on the screen to see whether any aspects of our digital package might be helpful for your community as well. We also have conversation cards that turn awkward mental health talks into meaningful family moments. The idea here is, our schools issue copies to parents who might require more support in having such conversations with their children. We also have a digital toolbox for busy parents, and it comprises bite-sized, just-in-time actionable strategies. Because we recognize that parents are busy and just want something, on the go, that also helps to make clear the different avenues from which they can seek mental health services. Through all these strategies, we also weave in clear pathways to professional help where needed. And our goal here is to make mental health conversations as normal as talking about homework or weekend plans. This is to reduce the stigma of children openly discussing mental health plans with their parents and to build more mentally healthy and resilient families. Now, let me just talk about our youth support specifically. We have youth teams called CREST Youth and Youth Integrated Teams. And they meet young people where they are, and not just in hospital rooms, but really in their communities. Right? And the idea here is that it supports youth by building mental health literacy and mental resilience from a young age. The CREST Youth teams support parents and peers in the recovery journeys through Youth for Youth initiatives. And these make it more accessible to youths and provide an alternative to school or hospital-based services. Our youth integrated teams provide mental health assessment, intervention, and monitoring for youths with mental health needs. And the services aim to provide youths with easy accessibility to mental health services. The teams collaborate actively with other youth agencies, schools, and community partners to provide holistic case management for youths and their families. And my colleague Eric will go into more details later on. Earlier, the Tokyo Metropolitan Institute of Medical Science spoke about schools, and I fully agree that schools really is not just about math and science anymore. It's also about mental health hubs, right? We know schools have an important role to play in upstream mental health promotion. And this is why our schools adopt a tiered approach to support students' mental health and well-being. We have incorporated mental health education into the curriculum, and students are taught to spot the difference between normal stress and something more serious. They learn to break negative thinking patterns, and most importantly, they learn that it is okay to ask for help. And within the school, there's an ecosystem of support. We train our teachers to spot distress signals. We equip our educators with facilitation skills to conduct conversations on mental health in a manner that is age-appropriate and sensitive. We also train students to support one another, right, through our peer support leaders. And as part of all this, we weave in clear paths to professional help with referral pathways for students to receive support from the school counselor or further intervention from mental health professionals. But of course, government can't do this alone. As part of our efforts to expand the capacity of mental health services and enhance service coordination across service providers, the government partners community-based mental health service agencies. And community partners such as SHINE help us to improve the outreach and coordination of mental health services alongside government services. I'll now hand the time to Eric from SHINE so he can introduce SHINE and explain more about their initiatives that help to tackle mental health issues. Thanks, Eric.
Thanks, Mingwei. Yeah. Carrying on, 3 key things to highlight, the Singapore's approach to addressing youth mental health issues. Number 1, partnerships. Number 2, youth friendliness. Number 3, multiplier effect. So as you are aware, the CREST Youth program is a government-funded preventive program in the community. Via roadshows and talks in partnership with schools, we increase the mental health literacy of the young people, and thereafter it boosts their help-seeking tendency. It's not uncommon that we hear post-outreach, the young person approach us, or their peers encourage other students they know having mental health concerns to come to us. We have also left some of the badges that have been curated by the students on the desk of the various delegates. You are free to take them and keep them. Next up, YIT, another government-funded program, intervention within the community itself. It helps to remove barriers such as stigma, cost, and inconvenience. As the young person's mental health concerns are addressed within the community, they do not need to escalate to receive higher-tiered support, thereby reducing the strain on the ecosystem of care. Often, the youth feedback that because of the greater availability of intervention within the community, it helps them to seek help earlier, stabilize their mental state, and also prevent deterioration. Apart from government-funded, apart from government-funded services, we also partner with private funders. And we deploy a range of youth-friendly programs such as animal-assisted care and peer support initiatives. We'll share a couple of them today and hope that some of these insights and learnings might be helpful. First, using the peer support initiative, we deploy trained volunteers to journey with young people for a period of at least 6 months. And the benefits are not just for the youth service users, but also for the youth volunteers. For instance, a youth volunteer shared that after learning more about self-harm via our training, instead of seeing it as an attention-seeking behavior, they now see it as a connection-seeking behavior. And now the volunteer makes it a personal mandate to help people correct this misconception. So there is the multiplier effect. For animal-assisted services, it helps the young person to reduce their sense of anxiety and stress, and they are more open to form connections with people as well. Again, the effects go beyond the program itself. Often we hear feedback from educators and parents that they have seen elevated moods and help-seeking tendency from the young person as well. Finally, we also deploy a range of digital solutions. We use social media to outreach to young people, increasing their mental health literacy. We also use identified mental health apps to deliver supportive services. All these things are done to make the services more available, since the mental health app is 24/7, and also there's greater level of personalization since they can use specific features to support their needs. We just want to close off by saying that mental health is not an issue to be addressed exclusively in the medical setting, but within the community, we are able to have responses, and the strong people, private and public partnership is really key to pilot initiative, scale and sustain them, as well as adapt them to various contexts. And agencies like Shine, where we are a bit more nimble, we can move accordingly to ensure that we remain relevant and effective for young people. Thank you very much.
Thank you very much. And next presentation is Tokyo. Please begin your presentation.
Good afternoon, everyone. My name is Nao Uno, Deputy Director at Liaison Office for Child-Oriented Policies of the Tokyo Metropolitan Government. Thank you very much for having this time today. I would like to introduce the Tokyo Metropolitan Government's initiatives on adolescent mental health. Here is today's agenda. First, I would like to address the current situation in Tokyo, Japan. According to a UNICEF report published last year, Japan ranked 32nd out of 36 countries in terms of children's mental well-being. In addition, the suicide-related death rate among children aged 10 to 19 is the highest of G7 countries. From a survey we conducted with parents and children from about 10,000 households in Tokyo, we found that children's well-being tends to decline as they grow older. We also found that people who feel lonely or isolated are more likely to seek connections with others. In response to this, we've been implementing various initiatives to support junior high and high school students who experience anxiety or concerns. Today, I would like to introduce two of these initiatives. Let me begin with the first one. I will explain casual chat consultation, Good Chat. One background factor behind feelings of loneliness and isolation among children and families is lack of communication. This is partly due to the increase in nuclear families in Tokyo. Have you ever had a moment when you felt uneasy, but not serious enough to talk about friends or family? When such small worries are left unattended, they can gradually grow into larger concerns. That is why we decided to create a chat-based service where people can easily talk about any vague worries. In January 2025, we launched Good Chat. This service is for elementary, junior high, and high school students, as well as parents from the pregnancy stage through their child's high school years. Now, please take a look at the introductory video of Good Chat. Before starting the service, we conducted demonstrations at schools and gathered feedback on what kind of service would be easy to use. Based on this feedback, we developed 3 key features. First, the chat format, responding to feedback saying that chatting makes it easier to open up. Second, anonymity, so users can feel safe without sharing their name or face. Third, the ability to choose counselors by checking their profiles in advance. In addition, the service is available in multiple languages. By using auto translation, users can chat in about 250 languages. From there, to make the service more approachable for children, we also created a mascot character called Guppy. With its big, fluffy wings, Guppy gently embraces those who are feeling worried or anxious. Good Chat allows parents from pregnancy and childbirth through their child's transition into adulthood, as well as children from elementary through high school, to consult about a wide range of concerns tailored to different life stages. Good Chat offers various types of counselors. For example, psychologists, when users feel emotional distress. Nurses for concerns about physical changes. And university and graduate students who can support from a perspective closer to the user's generation. Users can choose a counselor depending on the nature of their concern. However, some children told us that it was difficult to choose a counselor because they could not easily imagine what each professional does. In response, we created manga-style content that introduces each counselor's expertise and the types of concerns they are best suited to address. The manga shows junior high and high school students growing through their consultations on Good Chat. Now, I would like to share some results so far. Since the service launched in January 2025, the number of users has steadily increased, and the average number of daily consultations has grown to about 5 times the initial level. Notably, 88.1% of users are children, which is a rare achievement compared to other consultation services. This slide shows the top 3 consultation topics by age group. Among elementary school students, concerns about school life, such as conflicts with friends, are the most common. For junior high school students, physical and emotional changes are significant, so concerns related to mental and physical health are the most frequent. Among high school students, in addition to concerns about academics and future education, many also seek support for mental and physical health. The slide shows the results of an AI-based analysis of chat consultation interactions. Compared to the start of the consultation, negative emotions decreased by approximately 60 points, while positive emotion increased by about 40 points by the end. These results show that talking through Good Chat helps ease users' emotional burden. Our goal is to create an environment where seeking consultation is a natural and accessible option for everyone. By standing alongside children and their families, we aim to build a society where people can feel safe and connected. Next, I will introduce a new initiative related to adolescent mental health. As Mr. Nishida explained earlier, shifting from a reactive approach to a proactive approach is an effective way to address mental health issues. One of the key strategies for this shift is a scientific approach that makes effective use of digital environments. Tokyo will newly work on developing a program to promote adolescent mental health. This focuses on 2 key points: the use of digital device-based approaches and the preventive effects of cognitive behavioral models. We plan to co-develop with research institutions a program based on cognitive behavioral models. This program is designed to help adolescents develop mental health resilience skills and will be delivered to junior high and high school students through digital devices. It is also important that as many adolescents as possible actually engage with the program. To achieve this, we will create promotional content that reflects the opinions and ideas of students. The Tokyo Metropolitan Government will continue to strengthen adolescent mental health measures in order to realize a society where every child can hold hope for tomorrow. This concludes my presentation. Thank you very much.
Thank you very much. And next is Toronto. Okay, please begin your presentation.
Okay, well, I'd like to introduce myself once again. My name is Heather Tillock, and I'm the manager of the Youth Development Unit at the City of Toronto. I do want to thank the Tokyo Metropolitan Government for bringing together all these subject matter experts in the child and youth space to collaborate and learn from each other. I feel like this conference really brings together my personal and professional hats. So my personal hat, I'm the mother of a 21-year-old who's in her 4th year of university at the University of Toronto, and a son who's 19, and he's in North Dakota playing football at the college level because he wants to play professional football. So it has been quite a journey getting those children to launch. So lots of what we're talking about here today resonates for me. You also heard me say that I teach at the college level, and one of the programs I teach in is the Child and Youth Care Program. So again, lots of synergies there, both in terms of the theory and applications. And then finally, the hat that I'm delivering the presentation to you today is as the manager of youth development at the city. So I'm going to tell you just a little bit of statistics. I didn't actually put any up on the slide, but in terms of Toronto, our population is about 3 million. So, a good solid size. And our youth population is approximately 700,000. So about 1 in 4.23, the data geeks can probably tell me what that exact number is. So a fairly substantive youth population. Our youth development unit sits within social development, and you'll see the other units that are listed there. And then that sits in the bigger division, community development and social services. So this is led by a deputy city manager, Denise Andrea Campbell. So community development and social services is dedicated to enhancing the quality of life for all residents by providing comprehensive social support and development programs. We also have a number of mental health strategies and frameworks that support the mental health and well-being of our population. One such strategy is the mental health support strategy, and essentially it's a mental health plan for our city to improve mental wellness, reduce stigma, and address systemic inequities in health access. And it is targeted towards particular groups: Black, Indigenous, youth, LGBTQ, seniors, so any groups who might have multiple barriers and disadvantage. I'm going to be focusing most of my presentation on youth, but I did want to mention our middle childhood strategy, developed in 2012 and continues to be prioritized in Toronto's Children's Services Plan 2025 to 2030. And our groups in this area work with community partners to ensure children in the middle years have equitable access and affordable, sustainable, and a relevant range of cares and supports. Many of these programs will be familiar to all of you: before and after child and school, childcare programs, recreational programs, drop-in, and specialized support programs. So we have a youth outcomes framework. You heard me ask yesterday to a couple of the presenters, how do you measure success? What are your indicators of success? So the City of Toronto has put a number of resources into developing a youth outcomes framework that helps us tell the story of how our young people are doing. It serves as a structural tool for programs and organizations to simply measure the impact of our initiatives on young people. And any program that provides youth services, we ask that program to use the Youth Outcomes Framework. So those could be programs that are delivered internally at the city, but also the programs delivered externally by our community partners, so that we are all using the same indicators and telling a consistent story. So I'll be talking a little bit more about 2 or 3 programs in particular that focus on adolescent mental health. And I'll start with our Community Healing Project. And when I tell you about this program, it will sound probably in some ways somewhat similar to our friends in Singapore in terms of that peer mental health model. So the Community Healing Project is developed and has been developed and delivered by our Youth Development Unit. And for our Youth Development Unit, we have a number of principles that we put into when we're developing our programs. They have to be healing-centered, culturally responsive, inclusive, evidence-based, and youth-centered. And so any program that we're developing goes through that lens to ensure that it's going to meet the needs of young people. And the overall goal for any of our programs is that all youth can pursue their hopes and dreams and aspirations free of barriers. So the Community Healing Project, also known as CHP, is where youth participants are trained through trauma-informed workshops, and they become certified peer support healers. And they can go on and share in the community what they have learned with other young people. So it really is a non-threatening way for young people to go into the community and talk to other young people about their mental health. We work with community organizations. We go into the schools. We do it at both the elementary and high school level, and we have found a lot of success with this program. And it's such a flexible program that we're able to adapt it to move into many different spaces. So really excited about seeing where this program can go. Another program that we have is called Community Peers. So it's essentially an extension of the Community Health Program. So graduates who have completed the Community Health Program can move into Community Peers. And this is a mental health peer model. So it's available to community organizations. They can call on a community peer to provide on-site mental health supports. And these peer mentors engage with young people. They provide resources and offer additional mental health support options, and really helping youth access the care in a way that they feel comfortable, empowered, and safe. These positions are paid, so it's one of the great things for folks when they move into this peer model. They are actually paid for their services. And we have found that the Community Peers program is an entry point or pathway into other jobs at the city and other jobs in the social service and mental health sector. The Community Peers program has worked successfully with many local community organizations, again, including our district school board, Kids Help Phone, our local transit system. So again, so flexible. It was working with the transit system to ensure that, because young people weren't always paying the fare, and fare evasion became a really big problem for the transit. So just working with young people to talk about how we could pay our fare and doing that in a way that wasn't punitive. Another program we have is called TYPE. I know that the screen might not be so large there, but that's a mobile intensive case management program that supports vulnerable young people ages 16 to 29 who are facing multiple complex barriers. It could be anything and any issue that these young people have: housing, mental health, job readiness, education, advocacy, family well-being supports, you name it. It's anything. One of the really unique things that I love about the TYPE program is that it has young people involved in this program can access life stabilization funds. So those are funds that they could use to pay their rent, if they need to get new clothing to go to a job interview, or if they need special shoes or safety or tools or licensing, certifications. We've actually even used it for someone to take their dog to the vet because this was their support animal, but they couldn't pay the vet fees. So this life stabilization fund is really flexible. It doesn't have some of the same criteria that our other funding programs have, so it allows us flexibility to meet youth in terms of where they're at. And then finally, our Toronto Community Crisis Service, again, very similar to our peers in Singapore, where it's a mobile community-based response. It's not police-led. Young people can call 211, and a mobile crisis team comes out to meet young people where they are, and it's 24/7. So it sounded a lot like CREST and Comet that our peers in Singapore talked about. So this is a really great program. So that takes me to the end. I'm always challenging my students to think outside the box and generate solutions to our wicked problems. So I want to challenge all of you to think outside the box, go back to your respective home countries and think about implementing something new. I think that's one thing we can all take away from this. And I'll just wrap up with a quote from Mother Teresa. I alone cannot change the world, but I can cast a stone across the waters to create many ripples. So I will remind all of you to continue creating ripples. Thank you very much.
Thank you very much. Please begin your presentation.
Thank you so much. Dear colleagues, my name is Ishita Mohil, and I work as a policy advisor at the Office of Deputy Mayor Bettina Emmerling in Vienna. In my role, I focus on key areas such as education, youth, and integration policies. I'm very honored to be here today, and I would like to say thank you for the invitation. Mental health is a crucial topic for all our cities, but especially for children and young people, who are including teenager, adolescents, and young adults who are growing up in a fast-changing and demanding world. To begin with, I would like to give you a brief overview of the current situation in Vienna. Vienna is a growing city. As of January 1st, 2025, around 390,000 children and young people up to the age of 19 live in Vienna. Over the past few years, we observed a clear increase in mental health struggles among the youth. This trend has been visible since 2014, but has become much stronger in the recent years. Major crises such as the COVID-19 pandemic, wars, and rising inflation have increased the psychological stress for many people and families. At the same time, many children and teenagers face daily pressure such as bullying, both online and offline, worries about the future, increasing school pressure, and family conflicts. All of these factors shape how young people feel, think, and cope with everyday life. Mental health, therefore, plays a fundamental role. It is the foundation for learning, for resilience, and active participation in society. When young people feel supported and mentally strong, they are able to grow up well and reach their full potential. This is why early and targeted mental health support is essential. Against this background, the City of Vienna takes this responsibility very seriously. Today, I would like to highlight two initiatives that demonstrate how Vienna promotes mental health in a practical, accessible, and youth-friendly way. The first initiative is called FLOPSY, focuses on psychological support in youth centers. The second one brings mental health directly into schools. FLOPSY is a unique mental health project developed in Vienna. What makes it especially valuable is that it was created by the youth for the youth. The idea of FLOPSY was submitted by teenagers from youth centers in the 21st district of Vienna as part of the participatory Children and Youth Million. This program allows people between the ages of 5 and 20 to submit their own ideas and to vote on which project should be implemented. In this case, the idea was very simple. Psychologists should be present at a place where they feel safe and comfortable, which was in a youth center. Because of the engagement and the votes of other young Viennese, FLOPSY became a reality and was implemented as a cooperation project between the Vienna Psychosocial Services, in short PSD, and the local youth centers, combining professional mental health expertise with realities of open youth work. The goal of FLOPSY is to offer voluntary and anonymous psychological support directly into youth centers. It focuses on young people aged 14 and above. Young people do not need any appointments. They can simply come by, talk, listen, and get support if needed. The project started in 2014 2024 in 4 youth centers in the district of Floridsdorf. Since then, it's received very positive feedback. Many people say it was the first time they felt comfortable seeking for help because a psychologist was present and easy to approach in their everyday environment. In the beginning of each visit, psychologists participate in everyday group activities such as cooking, playing games, or engaging in informal conversation with young people. This presence helps to build trust and makes discussions about mental health feel more natural. When needed, one-on-one support talks are always possible, especially in crisis situations. A central aim of FLOPSI is early identification, enabling challenges to be addressed before they escalate. Another strength is the close cooperation between youth workers and psychologists. This creates a strong support network not only for the people, but for the youth worker as well, because they get support in their daily work. Due to its success, the project was expanded under the name of OPSI to 10 youth centers across Vienna. Now, 3 clinical psychologists visit each youth center every 14 days to offer regular help. The second initiative I would like to introduce is the Mental Health Days. This project is implemented across Austria, with Vienna being its most active location. The Mental Health Days target secondary schools, covering lower and upper secondary levels, meaning all children and young people after primary school. Mental Health Days brings the topic of mental well-being directly into schools, dedicating a whole school day to the subject. The workshops held in the morning are planned together with each school and are adapted to the students' age and needs. They are interactive and led by psychologists, social workers, or other mental health professionals, covering various topics such as bullying, body image, eating disorders, and many more. These workshops create a safe space where young people can talk openly about stress, pressure, fears, and challenges. They also teach practical strategies and show them where to find help when things become overwhelming. What makes Mental Health Days especially effective is the whole school approach. The initiative does not focus solely on students. Teachers receive training to recognize early signs of psychological stress, and parents or guardians are invited to information sessions as well, so that support can continue as well at home. Teachers feel more confident in responding to warning signs. And parents gain a better understanding of how to support the children. Overall, these initiatives create a sustainable awareness to provide early intervention measures. In Vienna alone, 114 mental health days took place in the last school year. In the current academic year, the program expanded further with an enhanced model called Mental Health Day Extended. A total of 125 days are planned, allowing Vienna to reach even more schools, families, and to strengthen prevention even further. In conclusion, both initiatives demonstrate that mental health support is most effective when it is embedded in the everyday lives of young people. Whether in youth centers or schools, Vienna prioritizes early support, active participation, easy access. By investing in the mental health of children and young people, we are investing in a healthier, more resilient, and more inclusive future. Thank you so much for your attention, and I look forward to hearing your thoughts.
Thank you very much. Thank you very much for coming back. I hope you had a great lunchtime. And we will now return to yesterday's session 2, places where adolescents feel a sense of belonging. We will now have presentations from 5 cities. Each city is requested to keep their presentation within 10 minutes. We appreciate your cooperation in ensuring that this session proceeds smoothly. Okay, we will start with London. Please begin your presentation.
Thank you. Good afternoon, everyone. Minasan konnichiwa.
Good afternoon, everyone.
I'm from the Greater London Authority in London, England, and it's an absolute joy to be here today and share some of our perceptions and perspectives from London on helping adolescents build a sense of belonging. It's also really amazing to be in a room of such experts and brilliant interventions happening across cities around the world. And another thank you to Tokyo for being such gracious hosts and bringing us together. I also wanted to give a special hello to the young people from Surabaya. It's really brilliant to have youth perspective and voice in the room, and it makes a big difference to how we hold these conversations. So thank you for joining us, and please do keep joining in and contributing as you have done. Oh, thank you. That's 30 seconds of my presentation gone now. I'll add it on at the end. London is unique and complicated, and it's full of opportunity and aspiration. And for context, we've got about 1.7 million 10 to 24-year-olds in London. So we're a big global city. And we know our young people face the normal challenges that all teenagers face growing up. And we know, as we've heard today, that the world is a very different place, perhaps, to what it was even 5 years ago. And our young Londoners tell us about the challenges they face with isolation, with poor mental health. They tell us that they sometimes lack trust in adults and institutions. They tell us they have worries about access to opportunities, skills, and employment. And they tell us that they have concerns about safety in their day-to-day lives. I'm sure they're challenges that will be familiar to colleagues in the room, but they're also challenges that directly impact perceptions of belonging. So it's really important that we come together to think about how to address them. And how we respond to that in London is shaped by a complex system. So we have national government, and I've shared a link to our brand new UK National Youth Strategy here. It was only launched in January. We have local government, and there are 33 local authorities in London alone, each with distinct statutory responsibilities and political direction. And importantly for our conversation today, we have hundreds of youth organisations operating across London and thousands of highly skilled youth workers delivering direct connection with young people every day. And then there is us, the Greater London Authority. We operate across the region from City Hall to deliver the Mayor's priorities and commitments to Londoners. I hope some of these are common themes, but I've tried to set out what we see as the foundations of belonging, and I think it's just worth talking to them and articulating them out loud. We have place. Place is because belonging needs somewhere to land. And we have space. And space is the relational quality of a place. And places only matter to a young person when they feel safe. We have time. And that's the belonging built through repetition, consistency, and patience. And we have trust. And that's the confidence that young people have that we as professionals and the system around them will act with care and consideration for their needs. And then we have agency. And that's when young people feel they're able to influence the world around them and have a direct input on how their lives emerge. I hope they're familiar senses of belonging to you all. I'm going to share a few case studies from London around ways we've worked to develop belonging. They're all examples where we've tested a delivery approach. And I'm really keen to share the learning. And in the bottom link, you'll see some examples of tools and approaches that are hopefully adaptable or adoptable globally. But please do reach out if any are of particular interest. The first case study is the Mayor's Young Londoners Fund, or YLF. This was a £45 million investment in 218 youth programmes, and it reached over 150,000 young people. Really, it's an investment in place and space, those two core pillars of belonging. And the learning here is, of course, that mass investment in youth delivery is really important, but we also know that financial investment can be a really hard thing to do at scale. So the learning we also want to share is that a range of delivery activities should be funded. And what we mean by that is a whole host of approaches, from mentoring to horse riding, from chess to kickboxing. A wider range means that more diverse ranges of young people will engage with the places that you're trying to establish. We also want to make sure that we share the learning around investment in skills of professionals and equipment, as well as direct delivery, because they're the facilitators that unlock so much more capacity and connection with young people. And finally, we want to share that YLF was really focused on collaboration. And that's building networks between youth organisations so that they can improve referrals, find connection between each other, and consider alternative funding approaches. And that's a legacy that lived beyond initial funding. London Borough Culture. Now, this is a really exciting one, and the premise is really simple. London boroughs can apply for up to £1.35 million of funding to deliver a whole year-long programme of cultural and arts activities on a local doorstep. It's shaped by local people, and particularly young people. And it's a really exciting celebration of place and a building of belonging through the recognition of culture. And that's something kind of unique to each of us as individual cities, that we reflect the local practices that we hold. Since 2019, many positive opportunities have been delivered for young people. Over 500 schools across 12 boroughs have connected and engaged. And it showed a major boost to local economy wherever it's been delivered. And it's a highly replicable model. I'm really happy to talk more about it. The New Deal for Young People. This is one that's really close to my heart, and I've spent many, many hours over the last few years trying to help this programme develop. It's built around the basis that lots of young people don't have access to trusted relationships in their lives or role models, particularly outside of the family home. And in recognising the evidence base that shows us that trusted relationships can have a really positive impact, New Deal for Young People was the Mayor's £34 million investment in mentoring. And we believe it's probably the largest single investment in trust as a core pillar of belonging that's ever happened. And it's a really significant reflection and point to say that we believe in trusted relationships making a difference. And these refer to the softer outcomes sometimes that are harder to track and harder to evaluate, but we know are the real important connectors between relationships for young people. Over 130,000 young people have had access to a mentor because of this programme, and we've commissioned over 159 mentoring services. That's 159 different delivery approaches, but all with trust as their core, heart and driver, which is the real difference. And young people made our funding decisions with us, so it's a really important reflection of young people's perspective. I also wanted to share the learning and approaches that have come out of this, and we've helped develop and shape some of the evidence base around attunement and relational practice, and you'll see that developed in the mentoring support programme and mentoring quality framework, which I've shared a link to. It's a highly acclaimed self-assessment toolkit for the sector, and it sets out standards for really good mentoring practice, and we're very keen to share and help local cities adapt. Holiday Hope. This one is recognising that outside of the school period, young people often lack structures and support networks, and for some young people that can be particularly isolating or challenging. So Holiday Hope is a £6 million investment in holiday periods. It's helping young people be upskilled, connected, fed, and keeping them safe during those difficult, sometimes challenging holiday periods. Really, Holiday Hope is about partnerships, and it's not the GLA delivering alone. So the innovation that I wanted to highlight here was something called the London Anchor Institutions Network, and I'm lucky enough to chair the group of anchor institutions. So that's the health services, the transport authorities, the police, the London Fire Brigade, who come together to share our collective expertise and resources to see how we can improve outcomes for young people. And it's a really replicable model that I think cities could really explore. So I've included a link to the Anchor Institutions Network there. And I did just want to touch on food, and I know we've got a food conversation to follow. But if you're ever struggling to get young people to a session or event, look again at your food offer, because it really is the hook that can bring young people to community events. The London's Violence Reduction Unit was set up by the Mayor in 2019, and is chaired and led by Lib Peck, the director. It's really about looking at the root causes of violence and developing a preventative response to stop the violence from happening in the first place. The piece of work I want to talk to from the VRU today is their inclusion charter. And this really is a recognition, and familiar to the conversations we've had today, that young people are safer in school. And a focus on inclusion can help reduce absenteeism and some of those rising rates of suspension and exclusion that we've seen across the UK. It's really about putting children's rights first and investing in inclusive practice, and it's about building a sense of belonging around the school community, because as we've all discussed, the school is a unique ecosystem, and for lots of young people is their sole connection and link to trusted relationships and the wider pillars of belonging. The success of the Inclusion Charter has been reflected in the high borough take-up, and it's a testament really to thinking about how you can get lots of partners and delivery agencies to connect and share one metric, and it was a conversation from this morning that I think this is really relevant to. The impact of London boroughs. I'll be really quick here. London boroughs are really close to my heart, but they're hotbeds of innovation and delivery around community and belonging, despite their different local political directions and responsibilities. I've shared a couple of examples that I won't go into in great detail, but Lewisham Borough's play strategy recognises the power of play and the unique play facilities that are available in different locations, and the need to protect, respond, and shape them to support local people to adapt them in different ways. And finally, just to share an example of collaboration, the Pan-London Care Leaver Compact is a brilliant example of collaboration across London with partners coming together to improve outcomes for care leavers. And it's led to some significant improvements, for example, free prescriptions or access to reduced travel. That's by working together. Still lots to do for care leavers, but it's a really good example of how collaboration makes a difference. And my very final slide, as I see the red light flashing for me, I just wanted to bring us back to youth civic action and that pillar of belonging called agency. And it's probably the hardest thing to deliver well and the easiest to misjudge. And I've been really really pleased today and over yesterday to hear how much youth participation and engagement is happening globally. And I think it's just to emphasise that it's a really, really important thing that we do, and we must keep committing to hearing youth voice. And I just wanted to leave a quote from Bernard Davis, who's a youth worker in England, and he said that good youth work must always start where young people are starting from, and that's about listening and connection and building belonging and all the pillars that we've talked about. There are a couple of tools here which I won't talk to, but young people delivering and trained to provide peer research has given us some really powerful outcomes and impacts and responses. And I wanted to share a final toolkit around youth social action delivered with a university in London, which might help your home boroughs think about how you describe civic action and where it might take you. That is the final slide. Thank you so much for listening.
Thank you very much. And next is Milan. Please begin your presentation.
Yes, good afternoon, everyone. Before starting, let me deeply thank Tokyo Metropolitan Government for having organizing this important moment of exchange. Arigatou gozaimashita. So I would like to address my presentation in 3 key moments. The first one is understanding the overall objective. The second one is about infrastructure and budget. And the third one is projects. So I'm going to talk about the food policy of Milan and how this food policy is deeply focused on providing food education to our children and youth. So very quickly, this back in 2015, during the Milan Expo, the mayor of Milan decided to launch the food policy to improve the food system. So this is a very, let's say, complex study of the food system and all the interactions. But the important thing here is just to say that the City Council of Milan in 2015 decided 5 priorities of the food policy of Milan, and one of them was food education. That should have been a priority for our work as a municipality. So we started work on that, and so this was the political objective, and now comes the infrastructure. So Milan is serving school meals since 125 years, of course, improving it year by year. And this is the infrastructure. That means that the city of Milan is responsible for delivering and preparing 83,000 meals per day, starting every day by cooking raw materials in the 24 kitchen centers that are the Red Cross, and delivering them every day in the schools that are the Blue Dot. The budget for all these services is around 110 million euros per year, and we serve meals from 0, so from nursery, kindergartens, primary school, and middle school, so from 0 to 14 years old students. So now let me move from the infrastructure, or let me contaminate the infrastructure with the project and with the education. So we were discussing before with the colleagues from Munich that the school, the feeding moment is just not a moment in which you have to feed the students, but it's an educational moment. And my vice mayor, who is in charge for that, she previously was a teacher of math and physics, always tell that the school meals moment is as important as a lesson of math or geography. So what we are doing here, we have been renovating the space of consumption, because it's not just a feeding moment, by renovating the dining area of the school. We redesign spaces and we apply behavioral building strategies, so to improve food environments together with our children. And the idea here is making them together aware of the sustainable and healthy habits that we are encouraging with a specific storytelling from the field to to the fork. So it's not a, let's say, children are not passively receive food, but they are part of the process of this service. All these, let's say, renovating areas comes with educational projects that we are undertaking in all the schools. Here you have some example, but we have many. Let me just focus on 2 or 3 of them. The overall idea is to have a whole school food education approach in which teachers, of course, are involved and trained, but also students and families. So, for example, we organize workshops. Every time we want to introduce a new recipe or a new menu, in advance we organize this workshop in schools when children can try, taste, understand why it's important to introduce this particular recipe, because it's sustainable, because it's healthy. And at the end, children and parents together, children, parent, and teacher will eat together, and then the meal is then introduced in the menu. At the same time, so it's also very important to get the feedback from families, from teachers, and of course, most importantly, for the user, the beneficiaries, who are the children. We also involve the producers in our tenders, and this is, I think, very important point for a public authority. More than 70% of the score to get the tender is on a quality basis. Only 30% is on the price. Apart from the organic, the sustainability, and all the certification, some points are given to the producers that organize educational activities for students. This means that the students and the school goes in the fields and see where and how the produce are farmed, harvested, and produce the products that then arrive in their plates. I have many other examples, as we have different projects, educational projects that we have conducted together with our cities in Europe, in South America, and in Africa, for example, in this case, because we wanted to extend the food education and the behavioral change, not just to the children that towards we provide meals, so from 15 to 35, so youngest, to make them not just aware, but also a lever for change. So with the Food Weight Project, for example, we try to turn everyday food places like school, markets, community kitchen into inclusive social spaces in which young people can make the difference, for example, by organizing a show cooking session, but also street action to not just to, let's say, advocates and nudge the young people, but also the rest of the other citizens. Well, I have many more projects to tell about, which involve also young artists that will support, let's say, the children by developing artistic intervention and creative performance in schools and outside schools, connected to the healthier choices that are. We are very lucky because the healthy choices for us is also the healthier choices for our planet. So other project in which you can see, or here, let me just show you. The picture in the middle is a picnic that the young people have organized in the main garden of Milan, where there's the castle, and this has been done simultaneously in 12 cities in Europe. So all the young people gathered in these 12 cities gathered together, and they organize picnic to sensitize. Of course, only healthy and sustainable food was allowed in the menu of the picnic. But as you can see also in my last slide, also with this project that is involving European and African cities, we are reshaping the places in which children are consuming their food by involving them to create a sense of belonging on the school and also in the canteens. So that's my last slide that comes with an opportunity. So if you are interested to work on this field, so school meals and food education, just join the Milan Urban Food Policy Pact, which is the most important network of mayors that are committed towards food system transformation, and school meals, food education is one of the most important pillars. And I'm very happy to say that here we have many signatory cities like Tokyo, Copenhagen, Brussels, Helsinki, Berlin, London, New York, Vienna, and Toronto. So if you want to know more and you want to work with us on this matter, just join the Milan Pact. Thank you very much for your attention.
Thank you very much. And the next presentation is Munich.
Where's the red light?
So please begin your presentation.
Thank you. I'm going to put this here. Okay. Well, thanks a lot for the invitation. David Weinberger, professor of Harvard, once said in his book, I think it was called Too Big to Know in 2012. He said, the smartest person in the room is the room. Now look around here. Yes, thank you for letting me be part of the room and this room to share. And actually, you made me rethink my presentation, and I had a hard work to overdo everything because of all your ideas that you gave to me. Munich is convinced that it is necessary to redesign their education. And now redesigning refers to two aspects, especially according to a project in Melbourne where they had, and they called it Rearrange the Way We Learn. It has a pedagogical side and an architectural side. We're trying to bring these two together. That's why I'm presenting to you today the learning houses and learning campuses of Munich. Let me start with a little insight to Munich. And actually, the only thing that you see is, in comparison to Tokyo, Munich is a village. But apart from that, it is important to see these figures in order to value the efforts that Munich has taken in the last 10 years, that you will see on the next slide. And also very important is, in Munich or in Germany, the towns, the municipalities are in charge of the buildings. So if the towns want to change education, the building is a very strong measure or, well, method in order to do so. That's why we focus so much on the learning houses and these learning campuses. In the last 10 years, Munich built all these places, which is quite a bunch. But it's not just the quantity, they try to build different. As different as I went to New Zealand after the earthquakes in New Zealand around Christchurch, they had to rebuild their education because everything was destroyed. Fortunately, Munich had no earthquakes. So we knew that we had to do it in order to build places of belonging. And we really believe that this is necessary and possible. It is a basis for well-being and health. So a very brief scope of the ideas that we're following, and that is the pedagogy. The L to the power of 4 and B to the power of 4 is going to be kind of a German lesson for you, because you find all these German words here, and they explain just because why we have L to the power of 4 and B to the power of 4. In the schools, and formally or up to now actually, we focus very much on the performance, solely on the intellectual, cognitive performance. A very focused and very narrow sight on what makes us a human being, we do believe. So in the future, and through the learning houses and the learning campuses, we try to create places to live at, a living place, being that the basis for places to live in, to learn in. That is a very important focus change that we're trying to achieve here. And if we think about belonging, I think you have them already here. The 4 to the B to the power of 4 concepts are even more important. We try to focus on the needs of the children. Yes, we have a curriculum, and in the curriculum you say what they have to learn, but there are things that are more important, and they do not reflect so much the needs of the children. There's a saying, "See me before you teach me." We try to make places that makes it possible to see the kids and what they need. So that is the basis for creating places for encounters, getting connected with the surrounding, getting connected with oneself, because that is the basis for very strong relationships. And education is about relationships. If there's no relationship, we're going to have a problem. Without relationships, no education is possible. So and with it, we have a change of role of what a teacher is. I put here more like a facilitator. We help, we support. We do not so much control. We are not at the side of the system. We are on the side of the students. And if we have these concepts, well, they build, more or less, these concepts build the architectural concept that I'm now presenting, the learning houses. As you see on the left, we are splitting up a school into different learning houses. A learning house is on the right is consistent of a marketplace in the middle, of the teaching rooms on the around it, and different rooms of differentiation. And we decide amongst pedagogical values how we structure this. In some schools, you have one grade in one house. In others, you have different grades in one house. Or you have children with learning disabilities within the house. So splitting up a school into manageable small units, which are the basis for, well, getting connected, for relationships. We realized, and we make good experiences with this concept of the learning houses, but we realized that we had to go on further. And so what the learning house is cooperating, sharing, not being alone. That's why the marketplace. I learned in Australia, a teacher told me, he said, well, Michael, we love the power of we. Well, we have a problem in Germany getting the idea of what is we. Because if you are alone, you won't be able to manage the task. It's not possible. So we had to think further on. And out of the learning houses, we tried to create the learning campuses. The theoretical basis is trying to create a 4-space model. In sociology, you have the first place, family. The second place, work. And the third one, we had it here in the conference, the third place, maybe the cafe, the restaurant, the playground, the museum, informal learning. In addition, we added now the digital space, and the digital place affects all the other ones. So trying to create a hybrid concept of room design, which integrates the digital with the real place, real world. That's the basis to it. So now we're trying to get the campus idea, and another saying that we had in the conference was, it needs a village to educate a child. I think it's from Africa, Nigeria, what I've read. Actually, we're trying to build learning villages. Now, what you see here is different schools. And these different schools have a shared place in the middle. The shared place is eating, the eating culture. Filippo, that's what we were just talking about. The third place is a library, a real important place, because the library also integrates the media. If we think about libraries as we have in Helsinki, the Odi, or Aarhus, Dog One. So if we have this idea of libraries, that is what we're trying to create now within schools. So we have these special places in the middle of a center. This is the center of the village, of the campus, and the houses themselves are learning houses, schools that are split up into the learning houses. If you're interested in it, and there's a lot of research that has been done, if it's possible to create places we feel well in, we have belonging to, with architectural measures. What a difficult word for me as a German. And as you can see, there are a few topics. Some of them we already mentioned here. Filippo just mentioned the nutrition aspect. The other one is movement. It's impossible to have kids being seated all this time. It's just impossible. So when we plan on schools, we follow kind of an idea, which is managing diversity by offering variety. So try to create places that have a great variety in order to reach everybody. That is kind of our aim to it. So, the red light. Last slide. We do believe that we can create homes, not just learning houses, but learning homes. And that those villages are unifying all these homes. Because if we manage to do so, they are places of belonging. And if we manage to do so, schools become out of a we have to place, we can make a want to place, where it's just cool to go there, where you want to go there by heart. That is our goal. Thank you for your attention.
Thank you so much. And next is New York. Though a representative of New York is unable to participate in person, Ms. Carly Avezzano will present her work through a pre-recorded video. Okay, now let's begin her presentation.
Hello, and thank you to the Tokyo Metropolitan Government for convening this important conversation. My name is Carly Avezzano, and I serve as the Director for Strategic Relationships in the Mayor's Office for International Affairs, and my portfolio includes the Youth Portfolio and Europe and Eurasia. Today, I'll be sharing about how New York City supports belonging for adolescents, and how we've learned that places for belonging are not just physical spaces. They can also be programs, relationships, and institutions that invite young people to participate meaningfully in the world around them. Adolescence is a critical period for building identity and confidence. At this stage, young people are asking important questions. They're asking, do I matter? Am I seen? Do I have a voice? Cities play a powerful role in shaping the answers to those questions. In New York City, we view belonging as critical and as something that we embed in our programs and our policies. It's foundational to the well-being, civic identity, and long-term engagement of not just youth, but adults as well. New York City has dedicated public agencies and programs that focus on youth well-being in the school, but also beyond the school day. The Department of Youth and Community Development is the citywide agency responsible for youth services. It funds and oversees community-based programs such as after-school activities, youth centers, mentoring programs, and summer programming. These are spaces where adolescents spend time outside of school. They build relationships with their peers, with trusted adults, and it's a space where they can feel safe and supported in their neighborhoods. An example is the Summer Youth Employment Program, which is a large-scale city program which provides paid job opportunities for teenagers during the summer months. Young people work in community organizations, small businesses, and public agencies as well. Through this program, adolescents gain responsibility, they're able to earn income, and they experience what it means to contribute to their city, which becomes a big source of belonging for them during adolescence. Another program I want to highlight is our Universal Pre-K and 3K. These are city-funded early childhood education programs, but they provide free schooling for children ages 3 and 4. While they're for younger children, they are important because they establish inclusive learning environments and a strong social emotional foundation that can help shape them as they grow into adolescence as well. So together, these initiatives reflect a citywide approach to belonging. It supports young people across all different ages, spaces, and stages of development. I now want to share with you about a program that exists through our office, the Mayor's Office for International Affairs. It's a city-led program that leverages the United Nations as a learning resource for New York City youth. This program serves students across all 5 boroughs, and it centers on one core idea, that young people feel belonging when they're treated as capable contributors to global conversations. In this program, rather than asking youth to simply learn about global issues, we invite them to engage with them, both locally, actively, and on their own terms. In this way, we're able to transform the UN, a global institution, into a place of belonging for our youth as well. A key piece of the program is the United Nations visit, and it's also one of the most impactful. For many students, the UN can feel distant or abstract, but it exists in their neighborhood. It's in New York City. So during these visits, students engage with global experts. They stand inside this globally significant institution, and they're invited into the dialogue. It definitely fosters pride, curiosity, and a sense of ownership over it as well. A lot of youth describe the moment as incredibly powerful and a moment where they really feel like they belong, both in New York City and in the world. Another key piece of the New York City Junior Ambassadors Program is a visit to a classroom by a senior United Nations diplomat. And these diplomats visit these classrooms across the city. Before the visits, students are able to research the countries that they represent, their diplomatic roles, and the global challenges that they address. On the day of the visit, the youth lead the conversation and they ask thoughtful, prepared questions. These interactions are really special for youth, and it communicates that their ideas are worth engaging with. They're able to see global leaders take them seriously, and it helps them feel respected, visible, and connected to the world as well. Lastly, another key piece of the program is their action projects, and they're able to find a sense of belonging through action. It's the final phase of the program, and they work in groups to identify a sustainable development goal that matters most to them. They research the goal, they plan, they collaborate, and then they design the project so that they're able to address a real-world issue in their community and connect it to the world as well. These projects are shared with the UN and the New York City community, and it reinforces that their voices matter and that through action, they're able to find agency and make a difference in the world. So some key takeaways from our citywide approach to youth engagement is that belonging comes through trust, voice, and meaningful participation. Also, adolescents thrive in spaces and programs that treat them as capable contributors and emerging leaders. And lastly, programs can function as places of belonging, even if it's extending beyond physical facilities or buildings. So the relevance for cities is that cities can adapt these ideas and introduce these to global and civically significant institutions within their cities to help them see themselves as part of something larger. Also, by designing programs that center agency and curiosity, cities can transform landmarks, partnerships, and relationships into places of belonging. When adolescents feel they belong to their city, to their community, and the world, they're more likely to care for it as well. So with that, I want to thank you all for the opportunity to share more about New York City's experience. I look forward to learning about the approaches of other cities and continuing this conversation about how we can continue to support adolescents so that they feel seen, valued, and connected, and can also make a difference in our cities and the world. So thank you, and I look forward to staying in touch.
Thank you very much. And next is Surabaya. As you already know, we have special guests from Surabaya Children's Forum. Following the city's presentation, two teenagers of the Surabaya Children's Forum will also give a presentation. Please begin your presentation.
Thank you very much for the opportunity. Minasan konnichiwa.
Hello, everyone.
Present about Surabaya as a child-friendly city, especially of how Surabaya city government create havens for every child and adolescent in Surabaya without any exemption, and not only in one corner of Surabaya, but in every corner of Surabaya. I lived in Japan before to pursue my master degree here in Tokyo. These pictures were taken in 2017, 9 years ago. The picture in the center, I was invited by Suginami Association to present about Indonesian traditional cultures. And the picture in the right above, I was out to make ikebana by a very beautiful Japanese young citizen. From Japan, I learned that to build a child-friendly city, we don't do extraordinary action, but we do ordinary action, but we take it in every single day basis consistently. Surabaya is a large and dynamic city, the second largest city in Indonesia, where many cultures, religions, and ethnicities gathering in one place. Surabaya consists of 31 sub-districts, 153 urban villages, 1,361 hamlets. In every hamlet, we have one community hall. While other regions in Surabaya provide children services up to urban village level, we want to reach the children closer. We extend the children's services up to 1,361 community halls. And Surabaya is a global city. We have accredited learning city by UNESCO, child-friendly city initiative by UNICEF, and healthy city by WHO CRO. And the journey of becoming a child-friendly city, we have awarded 7 consecutive times as a primary national child-friendly city. And in 2023, we have the highest score of women and child-friendly region among all regions in Indonesia. And Surabaya is the first and the only city in Indonesia to join the UNICEF Child-Friendly Cities Initiative. Surabaya city government always puts the children and adolescents in the heart of the development. Surabaya city government always involves children's participation in every stage of the development, from the planning, budget arrangement, until the monitoring and evaluation. We are doing this together with the children. And this is the scheme of how we create the heavens for the children and adolescents. And the intervention not only given for children and adolescents, we extend the intervention from the early childhood up to the adult and senior citizens, because we try to teach adult and senior citizens, we try to teach parent, great parent, and father to create home in their own respective families, in their own homes, because Indonesia also have an issue of fatherless. So we try to socialize with the fathers to accompany their children to pursue their ambition and aspiration. For early childhood, we had character development and holistic skill mapping from the early childhood and childhood parenting class. With elementary school, we have a learning together in community halls, learning scriptures together, scholarship for scripture memorizers, character education. And for junior high school, we have equivalency program. This is for dropout students, scholarship for underprivileged students, and talent development and psychological development. We have collaborated with many universities in Indonesia that have psychological major. So these lectures accompany in every elementary school and every junior high school about psychological assistance. And for senior high school, we had outstanding student dormitory, and we have entrepreneurial training, leadership mentoring, creative house, and broadband learning center. And higher education, we have one house, one graduate. And for adult and senior citizen, we have great school for great parents and learning center for recovered individuals with mental health conditions. For early childhood education, Surabaya is a national barometer for holistic integrative early childhood, when we try to always make fun transition to elementary school. And we have art talent showcases. In elementary school, we have free school uniform and learning together in 241 community hall and scholarship for Holy Scripture memorizers. For junior high school, we have scholarship for underprivileged students through CSR and religious charity organizations. And actually, there are several children in Surabaya who cannot afford to pay their school certificates after graduation. Therefore, they cannot move to get a job, or they cannot move to get a higher education. So that Surabaya city government covers this cost so that they can continue to pursue their job or to pursue higher education. In senior high school, we have 34 equivalency centers. This is the school from dropout students. We have outreach programs. So if we find there is any dropout student, we put the student in the equivalency centers within 5 working days. So today there is 0 dropout student in Surabaya. And we have youth scholarship. This is for senior high school students. We give 21,000 students, and we offer free language learning courses with 17 different languages for Surabaya children and adolescents. We also have creative learning house. For higher education, we have one house, one graduate. So we have the data of a house that there is no graduate in the house. We give them the scholarship. This is the way we cut off the vicious cycle of poverty in Surabaya. And for adult and senior citizens, we have Resilient Senior Citizen School. We have learning program for parents, how to nurture their children. And family learning centers, we have 532 in community halls where we provide psychology counseling for students and adolescents. And we have the application called Siap PPAK, where there is a panic button that can be accessed and clicked for 24 hours, where the children can in danger, whether in their home or their nearby, they can just click the panic button and the special task force will come to the location. And we have 585 bachelor degree scholarship. Education facilities, we have community reading corners, and Surabaya Children Forum, we have the secretariats not only in the city level, but also in the sub-district and urban village level, 5 mobile libraries, podcast, we have podcast studio for Surabaya Children Forum, so they can produce their podcast, and they invite famous people from Surabaya and other regions within the nation. And we provide children information center. For women, we have Women Information Center and learning program for women empowerment. For disabilities, we have talent development centers and academic learning centers for disabled students. While academic learning centers is how we can bridge the academic gap between disabled children and non-disabled children, while for talent development centers, we provide children with disability with 20 different skills and talents. And for digital literacy, that is important today, we have 54 broadband learning center and student assessment of mental health condition information center. So every student have to put about their emotion, whether they are happy, whether they are sad, through this application, so that we can monitor the emotional well-being of every student in Surabaya. And we have education for students, so they can access free courses in an ease. And Surabaya is ready towards gig economy in the 21st century. We have intensive labor program. Actually, we utilize the unused or unutilized Surabaya city government assets. We create a house for labor program. Therefore, youth that is unemployed can work over there. And we give the salary for 5 or 7 million rupiah per month. Right now, 41 intensive labor houses has been created. And we also have Surabaya Next Leader program, where we provide leadership skills and problem-solving skills for every adolescent in Surabaya. And we have circular economy training. We have program so-called Princess of Environment, where every student who would like to enroll, they have to plan minimal of 1,000 plant or reduce 1,000 kilogram of waste. So at the end of the year, one student can plant 100,000 of plant or reduce 1,000 tons of kilograms. And for the creation of infrastructure for students, we have community reading park, religious tourism, school bus, school children learning sign, mini agro-tourism, and in the football stadium, we have children's grandstand, especially dedicated for children, and educational museum and Kalimas water tourism for children. And we try to make every of infrastructure national standardized. And this is increasing participation. I have told you before that we try very hard to make every child and adolescent have intervention, not only 1 or 100, but every child. So we make many activities, just like cultural parade, in every urban village and every neighborhood. And increasing participation of the Surabaya City Children's Forum at the regional, national, and international level. The Surabaya Child Forum provides input and recommendation to leaders in the Asia Pacific region. And Surabaya Child Forum presented Surabaya on a child-friendly city in China. We also deliver in the first Tokyo Metropolitan Global Forum on Children, and Surabaya Child Forum take over TEDx for best social media, and we have so many awards for Surabaya Children Forum. And this is innovation in the fulfillment of children's rights in the Surabaya. Actually, we have so-called Sayang Warga application where every children of Surabaya has been monitored and assistance by the citizen of Surabaya. We have 31,000 Surabaya Hebat Kader who monitor the well-being of the children, and they input the emotional well-being or the physical well-being of the children through this Sayang Warga application. And we have BESTI program. It's a CSR initiative partnering with companies to improve child welfare. And actually, Surabaya tagline is Great Surabaya is built by great collaboration, and for everything, the intervention for children, we did it with Pentahelix collaboration. And this is Citalas. Citalas is integrated digital platform to support data-driven. So it is function as Surabaya one data system for children. It is managing 700 child indicators for 3 years, integrating planning, monitoring, evaluation, and children participation. And it is supported by artificial intelligence-based policy recommendation so that it can, based on those 700 data, the system can provide recommendation based on artificial intelligence, so that it can strengthen transparent and accountable decision-making, and it can be used by all departments in Surabaya City Government. And about Citalas, it is developed since 2023, appreciated by UNICEF, the Ministry of Women's Empowerment and Child Protection, and the National Development Planning Agency in Surabaya. Therefore, it has been adopted nationally as the National Child Proposal System called Suara Makna. Children also able to track the follow-up of their development proposals. Children can input their aspiration for the Surabaya city development, and they can monitor whether the proposition has been undertaken by the Surabaya city government. Because every voice of the children matter, this is the city where every voice of the children is valued and respected, and we try as best as we can with everything within our power to realize every aspiration of the children coming into reality. Arigatou gozaimasu. Yoroshiku onegaishimasu.
Thank you very much.
Hello everyone. Good afternoon. Minasan konnichiwa.
Hello everyone.
And you can call me Reva, delegates from Surabaya Children Forum, together with Areli. Welcome to Surabaya, a city where children's voice matter and dreams allowed to grow. Surabaya is a place where laughter lives in neighborhoods, schools, parks, and in every corner of the city. In Surabaya, children are growing strong, safe, creative, and kind. Here, children learn to play, to learn and to care for others, and to care for the earth. Surabaya believes that every child has the right to feel happy, protected, and proud of who they are. That is why Surabaya is building a city with children, for children, and led by children hopes. In this city, children Children are friends of the nature, friends of learning, and friends of the future. The city is home to 912 children aged 0 until 18 years. Surabaya internationally recognized with UNESCO as a learning city and with UNICEF as a child-friendly city initiative and with World Health Organization as a healthy city. Surabaya must ensure that every child is physically and mentally healthy. This is Child-Friendly Cities Initiative Journey. Surabaya Child-Friendly Cities Initiative Journey is built on collaboration between the government, communities, and the children. Prominent national child-friendly city for 7 consecutive years, and in 2023, Surabaya achieved the highest score among all the regions in Indonesia as a woman-friendly and a child-friendly region. Representative of the Surabaya Children Forums shared good practices on children's participation in Jinan, China. Surabaya established Children's Forum in every sub-district and urban villages. We have 31 sub-district Children's Forum and 153 urban villages Children's Forum. About Surabaya's Children Forum, or we call it Forum Anak Surabaya. Surabaya Children Forum is a government-supported initiative for promote their children's rights and make we actively in participation. We were given the opportunity to submit advice and criticism during the city development planning meeting. This is a place when we grow together, learn together, and take care of each other because every child has the same rights. This is the role of the Forum Anak Surabaya or Surabaya Children Forum, such as a pioneer, reporter, and embrace the role of agent of change, serve as a source of child-friendly information. The Surabaya Children Forum also often provides education to children about mental health. I proud to be part of Forum Anak Surabaya or Surabaya Children's Forum because I'm 14 years old, but I can join this Tokyo Global Forum Children. Thank you so much for this occasion. We are proud to be part of Surabaya Children Forum. And next, Areli.
Now I am gonna explain the next slide, which is good stories from Tokyo last August. During our learning experience in Tokyo last August, as I said, we engaged with the Tokyo Forum of Young Minds. That's me at the right corner, and where Tokyo Forum of Young Minds, where young people are encouraged to share ideas and participate through trust and dialogue. We also learned from Indonesian children who visited. I meant Indonesian children as us who visited Yusugunami Youth Center, a child-friendly space for learning, creativity, talent development, and sports. What stood out most was not only the facilities, but the trust given to the children, making the center feel like a second home. This experience inspired us to imagine similar youth-centered and supportive spaces in Surabaya, where children can grow safely and confidently. In Surabaya, support for children starts from the very beginning of their day. Through the free school bus program, children travel safely to school, build friendships, and
start each day with confidence. Safety creates comfort, and comfort supports both learning and mental well-being. Surabaya provides child-friendly parks and play spaces. These spaces allow children to run, climb, and explore and play safely, supporting creativity, cooperation, and happiness. Play is not only for fun, it is essential for healthy emotional development. Beyond physical safety, Surabaya also prioritizes children's mental health. Puspaga, which stands for Pusat Pembelajaran Keluarga and Anak, is a family and child learning center that offers free counseling and support for children and families. It helps children understand their feelings, seek guidance when needed, and feel genuinely heard. Digital tools like Mood app further support children's emotional well-being. In Surabaya, a child-friendly city protects not only their physical safety, but also their mind and emotions. These are the digital systems that Surabaya provides to support and involve children in city programs. The first is Sitalas, Surabaya's platform for child-friendly city initiatives. As Ms. Puspita mentioned, children can share concerns, participate in activities, and be heard, while the government responds to issues like stress, bullying, and mental health challenges. This ensures that children's voices are valued and that support is always accessible. Another tool is the Mood app, which helps schools monitor students' moods and detect early signs of stress, anxiety, and depression. It ensures that children's emotional well-being is cared for alongside their physical safety. Together with Sitalas and other child-friendly programs like youth centers and play spaces, these digital tools make support always accessible, helping children feel heard, safe, and confident in their daily lives. Okay, so this is the end of the presentation, our presentation.
Together with children, creating cities and towns creates futures.
Quote that inspires us. Where cities care, children care. Arigatou gozaimashita. Thank you very much.
Thank you so much for your amazing presentation.